Okay, hello. So it's the Saturday the 6th of July at about 6:30 p.m. and my surgery was in the afternoon of the 2nd of July. So it's been 4 days since my surgery, and the inflammation right now is definitely the worst. Like, it seems to have gotten actually quite a bit worse from yesterday to today. And actually I've got kind of discoloration as well. I'm not sure if it's going to be visible on camera, but just sort of down here I have sort of yellowish bruises. Not very obvious, but you can definitely see it. And just the whole area underneath the neck. I won't touch it because I don't want to touch the wound site, but the whole neck, apart from maybe just the sides, is really swollen, very noticeably so. If I turn to the side, I don't know if it's going to be kind of obvious. And I wore my bandage all of last night, and most of today. I've only taken it off for maybe a couple of hours just now. Doesn't really seem to, I don't know if it's really doing very much. And also the steroidal anti-inflammatories, I think I'm down to three a day now, and then 2 tomorrow and 1 the day after, and then that's it. So maybe I can switch over to some non-steroidals like ibuprofen or something. I am a little bit concerned because it's Saturday today. I didn't go to work yesterday, but I basically only have the rest of today, which isn't very long, and then I have the whole of Sunday, and that's it. I mean, I really would like to return to work on Monday, and I'm feeling fine. There's no question I'd be able to walk in to the office and do work, but it's just the way I look. I mean, with plastic surgery, it's a little bit not embarrassing, but it's not really the sort of thing you kind of tell everyone about, like any other sort of surgery. So no one at my work knows about that I'm having this done, and so I don't really want to walk into work with, massive bruising and inflammation, and not really have any kind of explanation for any of it. So I'm kind of hoping that the inflammation will start to. I mean, if it was supposed to be maximal at 48 hours, and here we are at, I guess, 92 hours, I'd be amazed if it keeps getting worse from this point on. I mean, I don't think it's to the point where it's really obvious, the inflammation. I mean, I don't know if people remember, like, perfectly well what my neck looked like before the procedure, so I don't think I could probably get away with it if I just kind of keep my head down a bit. I suppose what I am quite concerned about is the discoloration, because whereas people might see my neck and think, oh, is his neck bigger than usual? I can't tell. It's sort of sounds a bit difficult to say with certainty, but if I've got massive discoloration, like big purple lines down my neck from bruising, then obviously that's pretty unambiguous. So yeah, I'm a little bit concerned as far as that goes. I haven't taken any painkillers. Actually, I did take some paracetamol before I went to bed last night, so I guess I have done that. But the strong painkillers I was given, I haven't taken those in a few days. Sleeping is okay. It's still just not really annoying sleeping on my back, and with my head elevated with 3 pillows. It's still very annoying, but it's manageable. I can still sleep. Yeah, and it's still got a lot of jaw pain. Eating is still not very fun, and it still feels strange at the front of my mouth, especially my lower lip. Just kind of feels like it's being pushed up. I am starting to get a little bit paranoid about, will the implant is it staying in place? Is it able to like slide up and down? But I suppose that's kind of one of the nice things about having it screwed in, is that you know that it's bolted down. It can't slip up and down. Whereas I guess a normal chin implant, you wouldn't have that, and you're just kind of relying on the soft tissues tightening around it and kind of holding it in place. But I would imagine that for the few days after surgery you would have to worry a bit about sliding, so that's quite nice. I don't have to worry too much, but I am getting a little bit paranoid nevertheless. But yeah, it still feels like it's in the right place, and it's still, yeah, it's yeah, I'm still happy with it and everything. I think that's basically all there is to say at this point. I gotta say, yeah, it is. I didn't notice. I wasn't really looking incredibly carefully, but yeah, today's the first day that I've actually noticed the bruising and discoloration on my neck. So I'm a little bit worried, because obviously with bruising, it does kind of go through that cycle of, I think the cycle is normally it kind of goes yellow, and then it will go kind of purple and black, and maybe a bit green, and then disappear. So if it's only going yellow now, I'm a little bit concerned about the fact that it might be going to go an even darker colour before the bruising goes away completely, and that I am quite concerned about how to hide that. I mean, I do have, well, I don't have, but my partner has various concealers and foundations and stuff, so I might be able to. And also the fact that I can't shave, so I have all the stubble, so that kind of hides it a bit. So I might be able to disguise it somehow, or maybe I could wear clothing that disguises it, so, although it is the summer, so it's a bit tricky. But yeah, I mean, basically, the whole, as far as I'm concerned, the recovery is absolutely fine in terms of I'm not in any pain really, or any discomfort, and it's not really preventing me physically doing anything. My 90% of my concern is just about the social impact of the recovery and going back to work on Monday. Yeah, I am quite worried. So I guess we'll just have to see. I have my 1 week post-op with De Silva on Tuesday, so I won't be going to work on Tuesday, and so we could, I guess, conceivably take Monday off as well. Since I'm taking Tuesday off, I can just start back at work on Wednesday, so that would give me an extra 2 days to recover, which might be enough for this to sort of clear up a bit more. But I think we're just going to have to play it by ear. Yeah, I think I'll just have to check back tomorrow and see.